Welcome to Trends with Benefits, a podcast by Van Eck with a forward-looking perspective. We explore new ways of thinking about the markets, investing, work, and life. Here's your host, Ed Lopez.
Welcome to another episode of Trends with Benefits. Today we're going to be talking about preparing your body for COVID-19. Perhaps not so much about if you come across it, but perhaps when you come across it, to make sure that your body's in the best condition that it can be. And luckily we have Dr. Gil Chimes. Dr. Gil Chimes is the owner and clinical director of Greenwich Sports Medicine in Greenwich, Connecticut. He's a sports chiropractor who specializes in the treatment of musculoskeletal as well as sports injuries. He has postgraduate degrees in sports medicine, acupuncture, and is a certified strength and conditioning specialist. He is a diplomate of International Academy of Chiropractic Neurology and also has a postgraduate training in rehabilitation and nutrition. Interestingly, he's also the consulting chiropractor with the New York City Football Club, a soccer team, as well as the New York Yankees baseball team, where he spends most of the home games in the locker room treating players. Welcome, Dr. Chimes.
Thank you. It's a pleasure. Thank you for having me.
Well, one thing I note before we kind of get into the topic at hand is all your accreditations and in particular some of your specialties like acupuncture. Is that typical of the type of service one might expect when going to a chiropractor?
No, actually, I just basically over the years was looking for ways to improve my craft and find ways that I can accelerate healing. I took an interest in chiropractic because both sides of my family, my uncles are chiropractors. So my dad's brother and my mom's brother are both chiropractors. So that at a young age led me down the path of chiropractic. I grew up in a family where prevention was always preached to me: diet, exercise, sleep, chiropractic care, and it just felt innately right. I finally got to chiropractic college and I said, there's got to be more. And I felt like chiropractic was definitely a great tool, but I thought there was other tools that could be utilized to help enable people to get better quicker. And that led me down the path to nutrition and acupuncture and sports medicine. And I always felt that chiropractic was always maybe the redheaded stepchild that didn't get the respect that it deserved. And I started to seek out chiropractors who were starting to get incredible recognition for what they were doing. And that led me down the road into some of the soft tissue treatments, active release technique that really took off in the late 2000s in the sports world. So getting into the sports world, working with these athletes and seeing that there was so much that these high, I call them Ferraris and Lamborghinis, they require these high tech mechanics. So I had to step up the game. I had to incorporate all these different strategies in order to get the results that we were trying to attain. Eventually, being in New York, I'm in Greenwich, Connecticut, but being pretty much right outside the city, one of the Yankees, actually one of the free agents from Toronto signed with the Yankees. And that was my way to work with the Yankees. So I've been with them since '09. And working with that type of athlete, just you have to be on top of your game. If you're not, they'll know. So that's where I am now.
Do you find that anybody can benefit from your type of service, or is it really just the athletes that really need that kind of thing?
That's a great question. I think we all can. I do work with athletes, but it's a small percentage of who I work on a daily basis. I mean, I work with young kids who are playing sports, to the Greenwich housewife, to the weekend warrior like myself. People who just want to keep moving. They want to basically stay healthy. They want to stay optimal. So we work with everybody from 8 to 80. We do it all because I think everybody can benefit from the types of treatments that we actually utilize.
And do people come to you when they're hurting, or would you recommend a more preventative kind of maintenance and coming to see you on a regular basis?
Well, both actually. I mean, we call it prevention protection. We want to basically evaluate. We're actually moving into a new office in 2021. Hopefully, we're going to have a biomechanics lab there. And why are we doing a biomechanics lab? Because we want to pick up the subtleties. We want to see how people move. If they're moving wrong and they're loading their body incorrectly, that's going to lead to an injury. So if we can pick up and see how they're moving and interpret the data and see that they're overloading areas that might be susceptible to injury, if you think about it, can actually prevent injury. And then, of course, you have the people who tear an ACL. You have the people that blow out their, they herniate a disc in their low back. So obviously they come in because they're in pain. So we're working with both ends. So with my athletes, I mean, when it comes to professional sports, as you probably know, if we can keep those guys on the field, I mean, that's a huge benefit for these pro teams. I mean, the number of injuries that occur every year cost millions of dollars, but they also cost loss of games, they're not winning. So if we could figure out how to work with them and try to prevent an injury, that's huge.
Is your work all physical, or do you get into the diet aspect of things as well?
Well, I really don't think you can treat just symptoms. I think you have to treat systems, and you have to treat the human body as a whole. And when we're dealing with even just a normal person, or even a pro athlete, you have to look at their diet. You have to look how they're exercising. You have to look at their sleep. You have to see how their stress levels are, how their social relationships are. So you have to put all this together. When you work with a human organism, you want to see how they're adapted to the demands that are placed on their life. And if you can figure out, hey, you're deficient here, how this deficiency can lead to a better performance or improving healing, then you have to address all these aspects.
You talked about lifestyle factors, and some of those lifestyle factors kind of go into kind of prepping yourself for COVID-19. Can you talk a little bit about what lifestyle factors you talk to your patients about?
Well, when I sit down with a patient, I want to see, how are they going about their normal day? Are they getting out in the sun? Are they exercising? Are they getting fresh air? Are they maintaining normal weight? Are they getting adequate sleep? Are they modifying their stress levels? Are they eating a diet that's anti-inflammatory? I think we've heard in the news and the media, wash your hands, wear a mask, social distance, and let's wait for the vaccine. I mean, I don't need to be on a podcast for people to know that's what they're being told. But when I talk to my patients, I say, hey, did you know that diet can play a role? Exercise can play a role, sleep can play a role, supplements can play a role. And they're like, no, I mean, why aren't they talking about these things? This terrain theory where you can better prepare the body. And I say, it's like this COVID-19, this coronavirus is like a burglar on your street, and they're breaking into houses. They just haven't caught this guy yet, and they're waiting to catch him. That's the vaccination. Once we get him, now we're not gonna have to worry about getting our house broken into. But I also tell my patients, don't be that house that leaves the door wide open. Don't be the overweight, diabetic, who basically doesn't exercise, is stressed out, has going through a divorce, or their relationships are strained. They've basically left the door wide open for this virus to attack. Be the house that basically locks the door, locks the windows, turns on the alarm, turns on the spotlights. You have the Doberman pinchers roaming the perimeter and armed guards in the house. Let's do the best of what we know. Let's wash our hands. Let's socially distance. Let's wear a mask. But at the same time, let's be prepared.
So let's talk about some of those little things that you mentioned. Maybe we start with diet, for instance.
Yeah, I mean, I think diet is probably, I would put that in the top 3 in terms of exercise, diet, and sleep. I mean, diet plays such a huge role. We look at basically the people who are most susceptible to this particular disease, and they tend to be people who are overweight. So if they're obese, diabetic, if they're hyperglycemic, they basically are going to be more susceptible to this disease. So one of the big things that I talk to my patients about is, are you eating sugar? And sugar's okay, you can eat sugar. The problem that we're seeing in our society is we eat too much. 70% of people are overweight, 40% are obese, 1 in 5 kids are obese. So when it comes to the immune system, when it comes to protecting yourself, if you eat too much sugar, you're going to create inflammation. And we hear these things like, let's boost our immune system. And I hate hearing that. I don't like to hear boost, because I'm into regulating. I want to make believe I'm a car. I want to have a car that has brakes and gas pedal. Why? Because if I have a gas pedal, I'm going to accelerate when I need to accelerate, but I'm going to brake when I need to brake. And if we don't have an immune system that's able to brake and accelerate at different times, it's going to crash. And what we see with these people is they eat a lot of sugar. That creates inflammation. That leads them to hyperglycemia. That actually affects the immune system. That there's a white blood cell that engulfs these viruses. Well, when you're eating too much sugar, viruses are not going to be engulfed, so they're going to be able to replicate. People who are eating too much sugar, they're creating free radicals, and these free radicals spike inflammation. And there's a terminology out there they're using called cytokine storm. Cytokines are these little protein molecules that are going to either accelerate or they're going to break the immune system. And what we're seeing with these people who are hyperglycemic, who have what they call metabolic syndrome, they have high cholesterol, high blood pressure, they're overweight, they have high blood sugar levels. They are the most susceptible because they have an immune system that just accelerates. It's like I told my patient today, I go, imagine if I had a lighter and there's oxygen in the room, we're fine. I just turn the lighter on, fine. But imagine if there's a gas leak and now I turn on that lighter, the immune system just overstimulated and now the body gets overwhelmed. And now we have what they call a cytokine storm and people end up with these severe, possibly death, especially at that level of the lung. The last thing that's really important about sugar, in my opinion, is we know that this SARS-CoV virus can get into the lung through a receptor. Well, if you have too much sugar in the cell, guess what? It can get in a lot easier. It's like leaving the front door wide open. So when we look at our diet, I would say minimize your sugar. I always tell my patients, try to minimize sugar, grains, and vegetable oils because they will heighten up the immune system. They cause inflammation. And we're seeing a correlation of too much inflammation and all the disease that people come in with, whether it's pain, whether it's heart disease, cancer, diabetes, you name it, there's that correlation of inflammation, being out of control, not being regulated, and now we have all these diseases that go on. And then we start treating symptoms, which is a whole nother ballgame.
Do imbalances show up in other ways? I mean, like in your pH balance, you get a pH strip and pee on it or whatever to see if you're acidic or something. Is that something to watch?
I like to keep it simple. I like to tell people, hey, let's pay attention to inflammation, right? So how do you pay attention to inflammation? There's blood panels you can do. You can do your fasting blood glucose. You can check your cholesterol levels, your HDLs, your LDLs, your tris. You're looking for these pro-inflammatory markers. You're looking at something called HbA1c, which tells you how much sugar gets in the cell. You can look at vitamin D levels. So I like to look at these biomarkers, these blood biomarkers that are telling me, are you in that optimal range? And if you are in that optimal range, most of the time you're going to see incredible benefits to your health. You're going to see pain decreases, brain fog goes away, acne clears up, you see your cholesterol levels come into imbalance. So that's what I like to focus on. I like to focus on inflammation and are we regulating our inflammation?
The two other important factors that you mentioned, exercise and sleep. What can you say about exercise? I think I know what it might be, get some exercise, but is there something important to keep in mind with regards to that?
I've always been a big believer of using weights. I think weights put on muscle. I mean, with exercise, I think you have to incorporate cardio, but you also have to do strength training. You really do, because muscles are going to help with regulating insulin, so diabetes. When people get older, they end up with something called sarcopenia, where they actually decrease muscle mass. So weightlifting to me is number one. Cardio is number two. I think you should do both. I'm not in the camp where I'll only do one or the other. I think you should do both. But I don't think enough people do resistance training because they, number one, don't know how to. They don't have the equipment. But they could start with squats. They can start with push-ups. They can do pull-ups. I mean, some people have to start at a lighter level or decrease and then increase from there. Interesting, though. One of the big studies that came out in terms of exercise, I get some of these people that come in my office, they're exercising like 10 to 12 hours a week. They're sick and they're injured. I have to convince them that they have to decrease their exercise because we know that people who exercise too much, they actually suppress the immune system. And not enough exercise does the same thing. So 150 to about 330 minutes a week is what the literature is telling us. Get at least 150, but don't do more than 330 minutes a week. Remember, I keep bringing up this word regulation. Regulate how much you eat, not too much, not too little, right? If people who don't eat enough, if they actually are not getting the nutrients they need, they're actually suppressing their immune system. People who eat too much are overstimulating their immune system. Same with sleep, same with activity. We'll talk about sleep too, but exercise, stay within that 150 to 330 minutes a week. If you can do, 30 to 45 minutes of cardio 3 times a week and 30 to 45 minutes of resistance training 3 times a week, I think you're in that sweet spot. When it comes to exercise, I always want to know what people's goals are. In this particular environment, I would say 150 to 330 minutes a week, whether it's walking, whether it's running, whether it's high intensity. I mean, high intensity interval-based training is great for body composition. But again, doing too much, not good. Doing too little, not good.
So on the sleep side, can you get too much sleep?
Yeah, you could. You actually could. You could get too much sleep. I don't think that's a problem. I mean, in our country, I think we do a couple of things. We eat too much, we sleep too little, and we exercise too little. So I honestly, 7 to 9 hours a night is the sweet spot. So if patients are really interested in sleep, I tell them go buy the book Why We Sleep by Matt Walker. He's a PhD. I think he's at a University of Berkeley. That was one of the best books I ever read on sleep. I actually tell my patients my bookends. My next day starts the night before. When I fall asleep to when I wake up, that is going to influence the next day. You know, to answer your question, if you're not in that 7 to 9 hours, you can start controlling that. And that's not in bed. So I might fall asleep at like 9:40 and I wake up at 5:15 and it says I slept for 7 hours because, you know, you're in bed, but you need to fall asleep and then you wake up and 7 hours last night I got 6 hours and 53 minutes. I was so bummed. No, only joking. I didn't hit my 7. Sleep to me that's your rest and repair. That's your recovery. You need recovery because we're always sympathetic in that fight or flight. You need that because if you don't sleep, you don't heal, you don't recover, you're more susceptible to infections.
What are your best tips to get the best sleep? Is it some of the typical stuff like take the TV out of the room and no alcohol before bed?
Well, you know what? It's funny. I love wine, red wine. I can't drink it at night because I don't recover well. And I didn't ever pick this up. And I started to see this trend that when I drank wine, I would fall asleep. So wine is really good. Alcohol is really good because it binds to the GABA receptor. The GABA neurotransmitter is that calms you down and sedates you. You're like, oh, I feel so good. The problem is it wears off. And it usually wears off like 3, 4, 5 hours after drinking. And what ends up happening is you wake up and you affect that deep REM. That's your restorative sleep. I usually tell people to play it safe 10 hours before bed, 5 hours alcohol, 3 hours before don't eat, 2 hours, 1 to 2 hours, try to get the screens away. There's blue light. Blue light was from the sun. It wasn't really, we didn't have TVs, we didn't have iPads, we didn't have iPhones. So that actually will affect melatonin. And melatonin actually allows you to fall asleep. So if you're not falling asleep and you have a hard time falling asleep, try to do those things. So one of the things I realized was I breathe through my mouth. I'm a mouth breather at night. So how do I know that? My wife, you're snoring. No, I'm not. Yes, you are. No, you're not. So I read this book, and one of the things they talked about was taping your mouth shut at night. And I'm like, there's no way I'm doing that.
What?
And I have to tell you, I started to study the mechanisms of this. And when you breathe through the mouth, and if you ever go to a meditation, if you study transcendental meditation or you go to yoga, all the things that if you're stressed out, they tell you breathe through the nose and to inhale. They never say breathe through the mouth. And the reason for that, the mechanism, is when you breathe through the nose, as oxygen goes through the paranasal sinuses, it activates an enzyme that turns on nitric oxide. And nitric oxide relaxes you, calms you down. So if you ever watch, watching baseball, for example, the Yankees are in the playoffs, you see the guy up at, he's up at bat, or they step out of the box, right? What do? You take that deep breath, right? They got to calm down their nervous system. They're trying to regulate their nervous system, right? The pitcher, before he takes that, it's 3-2, bases are loaded, deep breath, right? I remember Andy Pettit with the Yankees always took that deep breath, and he always got that third strike. It was always, I'm like, good job, Andy. I tell my patients when I tape my mouth shut, I'm actually having an effect on the parasympathetic nervous system. I actually get a much better sleep. I'm reading this out through the Oura Ring, and the heart rate variability, which tells you how you've recovered, much better. There's a lot of research on this, not just my N=1, not just my data from doing it myself, but I will tell you that it's a little crazy when I tell people, they're like, you're nuts. And I'm like, listen, it works. It really does. And there's mechanisms for that. I would tell people don't do it immediately. Like, don't, if you like, I don't want to kill anybody on the podcast. I would say, just tape your mouth shut while you're up and see if you can do it. That's one of the biggest problems with people with the masks, by the way. They don't breathe through their nose, they're breathing through their mouth. I breathe through my nose all day, so I've forced myself to breathe. I wear a mask all day. Well, I don't have a problem wearing a mask, but some people, they have a hard time. And I think one of the reasons why is they're just not breathing correctly.
In your practice, are you seeing any work from home injuries or issues, whether it's like knots in the trap and back and stuff?
Oh, tons. I mean, this is one thing I've seen. People are working from home. More people have thank God for technology, because look at all the things we can do from home. So I will tell people, like, listen, let's look at your ergonomics. Number one, let's see how your workspace is. So how are you sitting? Most people are over their phones or their iPads. After a period of time, things will start to shorten. So what I always look for is, like, where's the pain? What is the overloaded area? I always tell my patients, if you put two kids in a room and you say, clean the room, the one that comes out complaining is the one that's overworked. So people will come in, they'll point to their neck or their traps and say they're sore. So that's the overloaded area. But then I start to evaluate, how's the shoulder, what's the mobility? And it tends to be these pec muscles tend to tighten up. So we do a lot of treatment to free that up. We'll do treatments, acupuncture, soft tissue treatments to just calm down the overloaded tissue, just to calm them down. And more importantly, we give them exercises. These are things you can do. Stretch these muscles, strengthen these areas. People tend towards these imbalances, so we want to balance them out. My therapist at my office, we do a lot of one-on-one here, do these things. We want to make sure they're doing them correctly. We don't want to just, they can upload the app and get the directions when they get home, but we want to show them how to do it properly.
And I'm just curious, because this is a financial podcast, but we talk about a lot of different things. Are you an investor in the markets?
Oh yeah.
Anything top of mind for you?
I've always thought that if you want to be successful, you got to listen to successful people. Do what successful people do. So to me, I think the biggest mistakes we make is we eat more than we expend and we expend more than we make. So my biggest thing is investing. We've set up an incredible, for our employees, a 401k profit sharing cash balance plan through the office. So we have an incredible retirement plan. We also try to fund, I believe it's 3 or 4%. So we don't match it, we automatically fund it. And we have advisors that basically, properly allocate the money, make sure that we're always investing, whether it's, the market's a roller coaster. I'm not going to jump off when it's going down. I'm not, you know what I mean? So I'm a sound investor. I'm in for the long term. I don't get emotional when the market goes up or goes down. Yeah, I like to see it go up, of course. But if you look at the trend, it's trending up. I'm happy. And I know that just investing in of itself, I'm not spending the money. So that money's there. So in my opinion, that's kind of how I look at the market.
Given your perspective in the healthcare industry, is there a trend that you find exciting that would be a good investment?
Well, I think the big thing right now, and again, trends happen because people are coming in telling me this stuff. The Pelotons, the Soul Cycles, there's something called a mirror, training from home. There's these organic food delivery services where they can give you the right proper macronutrients, whether it's, your proper grams and proteins, calories. You can pick what you want. I really see that staying healthy can be easier now, not harder, but easier, because you have the ability to do all these things. That the whole Peloton, I had patients that were like freaking out because they didn't know if they were going to get their Peloton. You know what I mean? So, and people who I call them soul psychos. I just tease my patients who go to soul. Yeah, they're soul psycho because they're I got to get to soul cycle. 12 o'clock. I got to make the appointment. So I basically see that they love to exercise and they're able to do it in the comfort of their home. So I'm starting to see this trend where people are doing more from home. I think people are going to work more from home if they can, but I think that's the trend I'm seeing, really.
Okay, so this is the segment I told you about, the trend or fad segment. I'm going to throw out a few different concepts. You can just say trend or fad. You can explain it if you want to, but you don't have to.
Okay.
CBD, trend or fad?
Oh, definitely a trend. Huge trend. The benefits, again, I'm not just into CBD. I think you have to understand that CBD, THC, these phytocannabinoids, they play a role. They work together, there's CBG, there's other ones, but I'm seeing a trend. And the ability to regulate the immune system using THC and CBD, there's a lot of research coming out on that. Amazing. I see the trend that this medicinal marijuana, medicinal cannabis, I think if utilized correctly, can be very helpful for people.
Weighted sleep mats, trend or fad?
Oh, I tried it. I think a fad, but it's up to each individual.
Intermittent fasting, trend or fad?
I would say if you asked me 3 weeks ago, I would have said a trend. Now I'm saying fad. And the reason for it is because I don't think intermittent fasting is necessary for everybody. I think intermittent fasting, the reason why there's so much benefit is because what it does is it shrinks the hours that you can eat. And we know people who are overeating, if you're shrinking the hours they can eat, then they're probably going to eat less. And you're giving your body a chance to heal, and you're not causing a ton of inflammation. I do it, by the way. So I've been intermittent fasting for a long time, but I think it might be a fad. We'll see.
We'll see. And then finally, standing desks, trend or fad?
They call sitting the new cigarette smoking epidemic. So I would say trend. I think for our health, I think a standing desk is great. As long as you move as well. Don't just stand in one place, move. Movement is life. Life is movement.
Dr. Chimes, thank you very much for your time. I really appreciate it.
Yeah, this was awesome. Thank you.
What's the best way for people to find you?
Our website's GreenwichSportsMedicine.com. We're on Instagram at Greenwich Sports Medicine. Those are the best ways you can reach us, learn a little bit about what we do. And if anybody has any questions or needs anything, I'm here for you guys.
Perfect. Thank you very much.
Thank you.
And thank you for tuning in to another episode of Trends with Benefits.